The Board of Direct Entry Midwifery will now exit executive session and reconvene open session at 10:38 a.m. No final decisions were made and no votes were taken in executive session. The public will be moved back from the breakout room, and representatives of the media may once again report on all board discussions and actions.
Thanks, Meredith. This is Lynette Pettibone, and I'd like to make a motion in case number 24-10986 that we open an investigation. Is there a second?
Motion has been.
This is Christine, I second.
Great. I will call for a vote. Rebecca Fisher, absent, I believe.
She did not come back.
Yeah. Okay, perfect. Sorry, just wanted to confirm that. So Rebecca Fisher, absent. Meredith Klein.
Aye.
Misha Ronick.
Aye.
Lennon Clark.
Aye.
Meredith Mance. Aye. Lynette Pettibone.
Aye.
Christy Morales.
Aye.
Great, the motion passes.
Okay, again, this is Lynette Pettibone, and in case number 24-11001, I move that we open and combine with case number 24-10974.
Motion has been made. Do we have a second?
Misha Ronick, I second.
All right. We will call for a vote. Meredith Klein.
Aye.
Misha Ronick.
Aye.
Lennon Clark.
Aye.
Meredith Mance. Aye. Lynette Pettibone.
Aye.
Christy Morales.
Aye.
Great. The motion passes.
And again, this is Lynette Pettibone. I'd like to make a motion in case number 24-10882 that we close that case and refer under ORS 676599.
Okay. Do we have a second?
This is Christine, I second.
All right. The motion has been made and seconded. I will call for a vote. Rebecca Fisher, absent. Meredith Klein.
Aye.
Misha Ronick.
Aye.
Lennon Clark.
Aye.
Meredith Mance. Aye. Lynette Pettibone.
Aye.
Christy Morales.
Aye.
The motion passes. Do we have
And
any
last-
other? Okay.
Yeah, this is Lynette Pettibone, and I'd like to make a motion in case number 24-10976 that we close unsubstantiated.
Do we have a second?
It's Misha Ronick, I second.
All right, motion has been made in second. I will call for a vote. Meredith Clark.
Aye.
Misha Ronick.
Aye.
Lennon Clark.
Aye.
Meredith Mance. Aye. Lynette Pettibone.
Aye.
Christy Morales.
Aye.
And Rebecca Fisher is absent. And that motion passes. All right, are there any other motions? Great. All right, so since we moved 8 through 10 from the agenda, that moves into number 11, which is the report. I had a question on this, and correct, I could be very wrong before we dive into it, but my question, I was under the impression in previous years that we did these reports annually, and it seems like they've been on all of our meeting agendas so far this year. I was just wondering kind of what changed, or is that because we have new members?
So if I remember correctly, we were doing them about every other meeting because every second meeting was a special meeting that
Okay.
we only focused on cases. But this meeting is a combination of that. And
Got it.
so I will try to not make this very long and bore you. But I do want to point a couple things out with the director's report. I do have the board membership. And in particular on the membership, there are 4 things that the board members, well, 3 things that are required annually. And let me correct myself. 2 things that are required annually is to go into Workday and take a OIS Information Training Foundation online course and a course preventing discrimination and harassment. There is a overview of Oregon ethics law, which is optional. And then there's the overview of boards and commissions, which is required once per term. And if you go into Workday and go into learning and just type in one of those, you have the words here. And I think those are hot links as well if you're online. So you could probably click on those and get right into them. Also with board membership, just a quick recap. We have Meredith Mance.
Wait, can we go back before we
Sure.
go on? Sorry.
Sure.
I have no idea how to use Workday. So how do we find out how to do that?
Do you have a Workday account?
Maybe, I don't know. I don't think so. This
I
looks
think-
new and unfamiliar to me.
Okay, so it is new. It's new to you because we are bringing it to you as part of this presentation for the board member recruitment. I think, and we can double check with Derek, I think when you came on, you went through some Workday, so you may have an account. If not, we can certainly put you in touch with Derek Foltz, and he can work with you to get you into Workday and get you onto these things. But you probably took the training because it was required.
Would it be possible, just in the interest of keeping it easy and equitable for everyone to access, is it possible to request that Carrie or someone just send out a Workday link to the board members?
Well, the
I
link
believe
is
she
in the
whispered-
agenda, but
Right.
so that's great.
But
It's
so
just a
there's
matter of
an
figuring out how to get in
individual
there.
So if you click
Right,
on
so
the
it's a pretty
link,
individual.
it'll take you to Workday, and you may go straight in. I know when I click on these links, I go straight into Workday, but I'm in there all the time.
Yeah, it wants me to sign
So
in, and
do
I
we have,
don't
like-
know.
Okay.
Yeah, username.
Okay.
and
We can send
password
an
stuff.
instruction sheet. How about that?
Yeah, we'll send an
Okay,
instruction
perfect.
sheet to you. Yeah,
Great,
thanks,
That was
Amy.
awesome.
Okay. So moving on, Meredith Mance is currently in a second full term, which expires June 30 of 2026, and Meredith cannot reappoint. Lynette also is in a full second term. It expires February 13, 2026, and cannot reappoint. Meredith Klein, also in a second full term, which expires 6/30/2025, cannot reappoint. Lyndon Clark is in a first full term, which expires 2/15 of 2027, and Lyndon can reappoint. Christine Morales, second full term, and it expires 2/28 of 2026, cannot reappoint. Misha Rodnick is first term, and it expires 2/15/2027, and can reappoint, and the public member position is vacant.
Did we not just introduce a public member? Did that change since the beginning of the meeting?
Oh, well, I guess it does. I stand corrected. Thank you. I will talk to Derek about that. Having a
Thank
complete
you.
report. Not a problem. And so these are your licensing statistics. In fiscal year 2024, we issued 7 licenses. And for the new board members, the state works on strange yearly times. It begins, fiscal year begins 7/1 of any particular year, July 1 of any particular year, and ends June 30 of the following year. Okay, licenses renewed. In fiscal year 2024, there were 79 licenses renewed. Licensed by age and gender. This is predominantly those that identify as female. Profession. Licenses by county. And as always, please note, these are counties of where individuals live, not where they're working necessarily. Licensing trends, pretty static. Currently at an average of 103.9 licenses. And that was for the fourth quarter of fiscal year 2024. Your financials, beginning cash balance was a negative 433,087. Revenue that came in was 54,172. Expenditures of 59,589. Net operations 5,418, with an ending cash balance of 438,504 negative. There was, actually, any questions on that part of the report? Okay.
Sorry,
Yes.
this is Misha. Yeah, I guess I just, in terms of, other than for sharing information in terms of the cash situation of the board, do you have any recommendations on how that should influence the decisions we make or anything? I'm just not sure how to contextualize that.
That's one thing we're always working on. And so you heard the discussion earlier about when to use subject matter experts or how to use them. That's, one of the things that we try to do. We hope we don't get complaints, because that's what drives up costs. So it's going to change, because I'm about to give some bad news. So if that answers your question for now, I will move on to the bad news. So let me change my screen here. So July 1 of 2024, this year, the fees are going to increase to what they were prior to the pandemic. So as of April 1, 2020, an applicant who was applying for original license totaling $800 was granted a $350 discount. And for renewals, that would be $800. This profession was given a $200 discount. And both of those end July 1 of 2024. This actually snuck up on us a little bit, and this is for transparency. Snuck up on us a little bit, and so we're currently getting an e-blast out and getting information out to this community, to the board licensees. So they're not taking, well, they're going to be surprised, but we're going to get the information out to them.
And this is Lynette. Is there anything we can do to renew any of those discounts? Because I've been a licensed midwife in Oregon, I think for 8 years.
Mm-hmm.
And when I first was licensed, there was a discount, and then that expired, and then we renewed and got another discount, and now it sounds like it's expiring again.
I'll have to explore that. So I'm currently the interim director, but let me explore that. And but in the meantime, this is gonna happen in July, and I don't think there's any way to mitigate it prior to that.
Well, my recommendation, and I'm sure that I would be supported by all the licensed midwives, would be work pretty hard to see what options were available.
Will do.
This is Lennon. Can I ask a quick question then to clarify? So you're saying it'll be 800 for initial and 800 for renewal?
Correct.
Right. Okay.
I mean, that's $200 per licensee, and there's 100 of them, of us. So it'll make a tiny dent in the $400,000 deficit, but
So, excuse me. So for 4 years, there's been the discount in place, and I will get with Sammy and our fiscal analyst and see what we can do and how we can make this happen. Because frankly, I don't know at this point.
I mean, this is Lennon. To be fair, I was licensed originally in 2008, and if I remember, it was about 22,000 or 2,400 a year. So it's still significantly better than what we started with a long time ago.
Correct.
That's right. I am actually working on a historical look at all the fees, but it's been reduced for, I would say, a good at least decade. We've been reducing them on a discount.
Well, and Sammy, another interesting thing to compare would be what other license types pay. So like, what does a CNM pay to renew their license? What does a physical therapist pay to renew their license?
But I think that part of the factor is we don't have a lot of licensed people, and we
Right.
have our own independent board. So I think those are the big factors.
Yes and no.
And
There's other states that manage it a different way. Yes, that's generally true that the boards must be self-sustaining and the practice must be self-sustaining. But like in Washington, for example, we've been able to lobby for some money from the state on a biannual basis that helps backfill that gap because of the benefit that midwives provide to the community. So, you know, the midwifery community, including OMC, could definitely help make something like that happen, but we would need the data to support it.
Mhm.
And we can provide the data that you need as requested. But in the meantime, we are working on it. But like I said, this did sneak up on us, and I don't know if we're going to be able to mitigate it and how soon. Since it's been a discount for 4 years, and I believe I've been with the office 12 years, and for most of that, it's been discounted. And it's because, and the fees are high because it needs to be a self-sustaining board, and it's such a few number of licensees, and it's an expensive board.
I mean, would you say that we are a self-sustaining board? I mean, when I'm looking at those numbers, it's like, that doesn't really seem like we are. I mean, so I wonder about like comparing to other professions and what their fees are, but also what is their board look like, or what is their, like, do they have a deficit like that? I mean, I think that's also relevant.
No, under the HLO program, boards are supposed to be self-sustaining. We work with each board. Each board is different. Cosmetology has tens of thousands of licensees. So it's hard to compare apples and oranges when you're speaking of that. Sammy, did you have something?
Yeah, I mean, when you're looking at least the professions in HLO and probably across all licensing bases like medicine or nursing, a lot of it's going to be factored on in our office is direct costs. So a direct cost for you guys are all of your legal fees. Cosmetology is not paying for DEM's legal fees. Cosmetology is not paying for respiratory therapy's legal fees. So those types of things increase what you owe because you have a high amount of legal costs. But when you're looking at overall, and cosmetology has 30,000 plus licensees, and their legal cost is much lower, right? But they get to spread all the costs across all those licenses, and you spread it just across a little bit of 100. So, and when you're looking at nursing, they're just one whole board. So they have one big budget, and all of that's laid out that way. But you guys have your own little budgets. The incentive of being HLO is if you are running in a deficit like DEMS are, you still have the ability to continue to run and operate because HLO can sustain that. And over time, you pay that back. But in other situations, you may, I don't know what the legislature would do, get rid of you. I don't know, never seen that happen, but that's the benefit of being an HLO.
Seems like a great suggestion, Lynette, for some activism around.
Okay. If you're ready to move on, and I'm sorry, I'm the bearer of bad news, we have the regulatory report. Trampus, are you still with us? There he is.
I am. Takes a second to get all the cameras and stuff back on. So here's the showing here is the regulatory report. As you can see, we have 3 bienniums still on this report, although I think that as open cases, I do believe that that 2021 open case is not actually open. I think it's in the administrative process. So, and several of the 2023s as well. This shows a distinction between open and closed cases. You can see that we have 22 currently open and 70 had been received for that 3 biennium. So we've closed 48 of them are past the demarcation line that we would say is closed. And 22 are still in the open category. And then complaints by type, we have licensing concerns, services provided, and then unassigned. Licensing concerns would be things about, somebody being unlicensed or something that falls more into a licensing category of, failing to meet a licensing credential or practice determination or excuse me, not a practice, but a fitness determination or something like that. And then we have service provided, which I think, that's going to cover most of our complaints. They're going to be about direct care midwifery services. And then complainants by type, we have 0 anonymous still, and we have 5 from clients, and 65 is the largest category of other. Other is a big category. It can cover, it's going to cover anybody who isn't the direct client. So it could cover a family member. Most of these, could cover, somebody else, a mandatory reporter somewhere, or it could cover a receiving medical provider, or, it's a big category. So, and you can see most of your complaints come from there. So that says something about that. Only 5 came from direct clients. But yeah, does anybody have any questions about the overall picture of this regulatory report? I know I actually have 2 board members. So maybe I'll just take 1 second to go back and explain what open and closed means. It's maybe not quite as intuitive as it seems. Open means it has been either like arrived at our desk and it's waiting to be reviewed by the board, even at all, to determine whether or not we're going to move forward with an actual investigation. It could mean that it's being investigated. It could mean that it's been completed but hasn't been reviewed by the board. It could also mean that it's been completed and the board has decided to issue a notice, but that notice has not quite gone out yet. So those are kind of all the things that open means. Closed means either it's been closed by the board, or the board has decided to put a notice out, and that notice has gone out. That's the point where we would close a case that has a potential disciplinary action. So that's what open and closed mean, and I give you a little more context of, especially the new members, of what numbers they're looking at here. So,
Trampus, do we have a tracking of how many complaints were made that we decided not to open in the first place? Like, that's additional to these 70, right?
Those were just captured here. These are complaints received. Open in this context doesn't mean we actually move forward in any kind, open an investigation. It just means we assigned a number to it in the system and presented it to the board to determine whether or not we were going to move forward with the investigation. So yeah, that number actually, I'm not sure I would have to just see if there was some good way to pull that number out. But, you know, whether or not the board decided to move forward at all, because sometimes we move forward without an investigation at all because the board makes that determination based on the complaint. So, but those are captured on this report. That's part of the 70.
Okay.
Any other questions for Travis? Seeing none, we'll move on to the next item, which is the policy report. And we still have Sammy online.
Yeah, so, and actually Lynette attended this as well, and actually probably will be able to provide much more input than I. But basically it was the last meeting that I'm under my understanding of the Birthing Center Rules Advisory Committee, which has been going since pre-COVID, so I couldn't even tell you how long at this point. But
It's
it
been like
really
5
focused
years.
around VBAC, at least 5. At least 5. But there was a lot of things that had to stop because of COVID, and then laws changed and all these things had to happen. But it was primarily focused on VBACs, and I'll let Lynette tell you the rest because it's her technical expertise.
It would have been good to have a heads up, but I could have guessed. So I don't think this is actually the last meeting. I know I personally voiced a lot of concerns over the participants in this meeting. And Sammy can talk about it a little bit, but there's a newer law in Oregon that rules advisory committees have to represent diversity, and there was no diversity represented in this meeting. And so my understanding is that there's supposed to be another meeting that will include more diverse participants as a part of the Rules Advisory Committee, or at least able to provide more recommendation from that perspective. But it was a great meeting, providing lots of evidence in support of keeping the rules as they are around allowing VBAC in the birth center setting. The health department seems to want to take them out and base birth center rules around HERC recommendations. And there was Catherine Bailey, for example, was on the agenda, and she spoke about kind of the perspective of the community midwife doing home births and how that might impact their practice and impact clients and impact safety, as well as choice for families. So hopefully the Rules Advisory Committee wraps up soonish, and by soonish, I probably mean a year. And the new, and the recommendations are summarized and the new rules are established, although the process for that in the Department of Health is really unclear to me and maybe to everyone on the RAC. Questions? Answers from more people? Thoughts?
Just a little addition, Lynette, thank you. I was on that RAC when it first started 100 years ago. And when we were doing in-person visits or meetings, and then it shifted, and then at some point I somehow got removed. I have spoken to, is it Melanie Bernal since then, and been added back, but there was some miscommunication that happened that didn't happen until, unfortunately, this meeting was already scheduled, so I wasn't able to attend. But I just bring that up to say that at least hopefully for the rest of them, I can join you again like I did in the past, to hopefully have a little bit.
Yeah, and
more.
you were on our radar as the RAC members, and maybe somebody reached out to you.
She did finally, yeah. But it was way too late to be able to attend, and then that finally got corrected. But yeah, it looks like I wasn't getting any of the information for a while up until then, because she had removed me from the list. But it is back now. So yeah, that's just to say hopefully there will be some sort of closure in the future, and I will be there in the future.
Okay. Excuse me. And next item, Sammy, we're going to do a review of supervision guidelines.
Yeah, I think Trampus or I think Meredith Mance wanted to go over these guidelines that are sent, that are the requirements that when somebody is required to do supervision, that these are the guidelines that they use to ensure that that supervision is happening appropriately. So there is some outdated information and that Meredith wanted to review it. So here it is to review.
Sorry, Tammy, I'm trying to remember the context in which we were wanting to talk about this.
Well,
It was
the piece that stuck out to you was urine dip done at birth, labor, birth, and immediately thereafter
Oh,
that the urine dip isn't a thing anymore.
That's right. I
Reason-
remember this. Okay. So for board members, I think this happened without anyone. That's why I needed to put it together. So this wasn't something that happened in a meeting. This was while I was reviewing final orders for a case that we
Yes.
were sending out, and it copied and pasted our supervision guidelines that are written in terms of like what counts that the supervisor is checking off on. And one of the things that stood out to me is that one of the required elements, for example, was a urine dip in labor. And so that goes to say that if the person whose chart is being reviewed didn't have a urine dip in labor, then that technically is, not following our guidelines. And so that kind of triggered me to just think like we needed to look at these really quick and make sure that they were up to date. Because, for example, that's something that, a urine dip in labor is not necessarily standard community practice immediately, or at least something that I don't think should be part of whether a person was providing adequate care, right? There are many circumstances where that won't happen. So yeah, I know this is kind of the first time we're seeing these. For me, I didn't know that we even had these guidelines until I saw them when we were writing that final or editing that final order. So wanted to make sure everyone else knew that they existed and just take a quick look and see if we wanted to remove anything or change them to be more up to date.
This is Misha. Are we supposed to be reviewing these guys? Where is it?
It should have come with an email from Carrie, I
As
believe.
part of the,
It's
Agenda.
on page 35 of the agenda.
I will
Thanks, Meredith.
say, I do want to review these, doing them like we didn't receive super far in advance and wasn't super clear to everybody what the plan was for these. So it might be hard to do a la minute, so to speak. But if there's anything that stands out that we want to remove or update, we can do that, or we can choose to read them and come to the next meeting with a plan to make changes or updates. I'm comfortable with either.
this is Lynette, and my suggestion would be that we review them in the interim and put them on the agenda again for next time.
I feel very comfortable with that plan. Again, I want to make sure that we're being intentional, and I think just doing them, as we go might be challenging. And I think that, the intention wasn't clear to the board members of what we were doing with these. So yeah, I agree. If we can maybe add this to the next agenda, and if everyone can review them and make some notes in the interim, then we can take care of it next time, I think, pretty efficiently and have any discussions about those suggestions.
Okay, so it's my understanding that the board is going to review them, and then we'll bring it back at the next meeting and get a decision and vote on them.
That's it.
Okay. Thank you. And then looks like we have some meeting dates and some board meeting logistics.
Yeah, so at the beginning, this is Sammy, the beginning of the end of last year, you guys scheduled a meeting for each month. every quarter would be an absolute meeting, and then all the other meetings would be possible special meetings. So it's pretty much been possible special meetings every time. And we have several new members. I wanted to make sure that you still want to, like, July would be one of your, July and October are your next permanent meetings. And then you've got August, September, and November that are tentatively scheduled as special meetings. Does 8 o'clock still work? Does Thursday still work? I just want to, is in person. I know we've had some meetings where there's a lot of logistics that have to happen, and it gets pretty dicey when we're going in and out of executive session. If possible, in-person meetings would be something you want to look at in some meetings. So just have a dialogue, make sure this is how we want to move forward, and just so we know what we should be doing. Because every month we're like, are we meeting? Are we not? Are we meeting? Are we not? So I know we're meeting in July.
Thanks, Sammy, if that makes sense. Yeah, so July sounds like the same as usual. I know I have kind of arranged my schedule for this Thursday morning, 8 a.m. meeting, at least for the year. How does everyone else feel about kind of long-term, or at least the upcoming meetings, what that would look like? I assume that we will need August. I mean, this informal settlement conference that we canceled today has to happen at some point, and so not a July, that will need to happen in August. So I
The
anticipate
August one is on a Friday. Do we want to, is that for a reason or?
That's probably wrong. Probably a typo.
got it.
Okay, so is it supposed to be the 15th instead of the 16th?
Here. Yep.
Okay.
Great, thank you.
So
Does
this is
anyone
when
have any?
I would propose to keep the Thursday 8 a.m. through the remainder of 2024, as I also have it on my calendar, but I'm open to having discussions about different days and times for 2025. I happen to really like the online format, although I know not everybody does. I think the biggest challenge for me of the online format is that we don't have those binders anymore. And I feel like being able to look through the binders was potentially helpful rather than getting random files here and there that we're trying to remember what pieces of that file we didn't have, and the logistics of getting a thumb drive, and then like the thumb drive doesn't even fit my computer, so then I have to find a different computer to get the information off the thumb drive. So that was a little bit challenging, but I like, especially since we have no idea the time frame for these, like, is it going to be all day, or is it only going to be till noon, or is it only going to be till 10? I'd rather not drive to Salem, but I'm open to conversation about it for next year.
I'm wondering if is it at all possible, just for like future theoretical questions, Sammy, to have a hybrid option so that if there are circumstances where if we did move to in-person, there's still the ability to call in? Is that too complicated? Because
No.
I do agree, like, I think it's an access issue if it is 100% in person.
Yeah, we can totally do both. Absolutely.
That's great to
uh,
know. And I do agree with Lynette that I would like to keep these where they are for 2024, and then maybe revisit what we'd like to do for 25. But kind of feels like the train has left the station on 24 scheduling, at least for my life, but it sounds like Lynette. Does anybody have a big objection or want to add anything to that?
This is Misha. I'm on board with Thursday mornings. This is great for this year for me. I guess I would just, the only thing I would bring up is I feel like the length of the meeting, it'd be nice to have like some estimate. I know some things are unpredictable, but I sort of feel like it's hard to have a meeting beyond 4 hours to 6 hours that's like continues to be productive for me. I get a bit burnt out once we get to 4 hours, but I know that's just my preference.
Yeah. Do you think we could like make is there a way to make an end time, or do
Yeah.
we kind of need to do what we have, do
Most
everything?
boards
I don't know if we
make
can
end
make an
times.
end time. Okay. That might be helpful if we just say like, you know, whatever. we can
Outside
get
of
done in this
HLO,
amount of time,
make
and
items.
everything else will defer to the next meeting. Because I agree,
Yeah.
it does get pretty long.
That makes sense
And-
to me, or at least having kind of a tentative time, and then maybe I understand that there are some meetings that will naturally have to be longer or a different end time because of things like informal settlement conferences and things like that. So I feel like I would be comfortable with it, not necessarily having to be like dogma, like it must be 11 every time or things like that, but based on the agenda. But I agree, having that kind of like general idea up front would be, in advance for scheduling, would make things a little bit easier.
So do we want to decide what that is? Like 8 to 12 or 8? I mean, I can't remember in recent times that we've gone that much. Like, I'm surprised this meeting isn't longer, frankly, with all those documents. I was like, oh my gosh, when can I book like something after this, you know?
Yeah.
But I don't know that it's lasted past 2 very many times. But somebody might have that actual information just then when I'm trying to remember. I'm just thinking
The
like,
last
it's
one is the
reasonable.
longest one I've been a part of, and that was what, like 2:30, something like that.
Yeah, that was really long.
So like saying 12,
Yeah.
12 or 1 would really capture like most of what we end up
Yeah.
needing to do. And sometimes it's done much earlier.
I also think that would be good for the general public as well, because I think that we don't get a lot of public participation in these meetings. And I think a big part of it is because we spend a lot of time in executive session because we need to, but also because they are a little tenuous schedule it like on how long they are. And it makes it challenging for people to schedule to come for an indefinite thing. So yeah, I mean, I would be comfortable, at least for our remainder of 2024, saying 8 to noon. But would it also be possible to say that, based on the agenda, as Terry or Sammy is putting that, or Bob is getting that put together, if there's a suggestion that it needs to be longer, for example, to accommodate a settlement conference, to tell us to make that suggestion in advance?
Let me think about that, because here's what we'll run into is you guys get into an executive session, you're flowing, and then we get to noon and we need to have public comment and nobody wants to stop. I mean, this is the reality. So right now you have public comment in the beginning of a meeting so that people can say whatever they want to say then, but sometimes that's not really, doesn't have any substance because they haven't heard anything happen yet. So I think let me think about it and I'll get back with Meredith Mance and see what would be the best. Is that okay?
Yeah,
Mhm.
that sounds good.
Okay.
And so for now, let's say we're going to stick with 8 a.m. on Thursdays for the remainder, and the next one will definitely be July 25th.
And can I ask
Perfect.
one more question? This is Lynette. Can I ask the board if your preference is for longer, fewer meetings or shorter, more additional meetings? Because we could keep those extra meetings on the books and use them so that we could keep the meetings shorter, but I don't know what people's thoughts are.
I know
Well,
this is going to be totally different for everyone. I personally prefer the monthly as opposed to quarterly, where they're a little bit more digestible, and so a little shorter, a little more frequent, but also I think it gives us an opportunity to stay closer up to date on cases as opposed to only quarterly with long meetings. So I am in favor of the more frequent, shorter, monthly being the more frequent definition. I think more frequently than monthly would be a challenge.
this is Misha. I agree. Just for logistics of scheduling and planning, it's hard to hold an entire day for the meeting. So I'd rather meet more frequently at shorter intervals.
Yeah, this is Len and I agree as
Yeah.
well. And I think it helps the cases kind of stay fresh in your mind, so you're not having to review it all and be like, oh, that's right. It helps you kind of keep track of it all.
This is Meredith Klein. That's what I would prefer also.
Yeah, same.
So it
Okay.
sounds to me like if we wanted by default, I don't know if anyone disagrees with this, keep those special meetings in our calendar and books, planning to use them
Oh yeah,
because it's a very
they'll
limited
stay.
cases. Okay, great. And so that way we have that monthly, and I think that will help keep some of the time down moving forward as well.
Yes.
I know with that really big one that we had last, we had a break just for scheduling issues and things like that. So I know that wasn't the intention for that to be such an epic meeting, and how it worked out. Yeah, so that would be great.
Yeah, and you and I can always, before an agenda goes out or whatever, can have a meeting and talk through the logistics and decide how to
Perfect.
best move forward with each agenda. That's not a problem either. We can do that.
Awesome. Thanks, Tammy. That sounds great.
All right, that's all I got.
All right, so the last agenda item is other board business. Does anyone have any other board business? The supervision stuff was mine, so we'll take care of that next time. If everyone can just make a point to read it and make some notes on anything you'd like to update or change to that, and we'll plan on talking about that at the next meeting. I don't anticipate that to be a long, crazy discussion, but just wanted to bring it to our attention.
This is Misha. I guess I'm just, for those of you who are more seasoned on the board, curious about ways you organize all these cases in your head about sort of where they are in these processes. I feel a little bit overwhelmed, like looking at the thumb drive of having the list of case summaries and then the cases for review that aren't necessarily the same cases and new cases. I'm not quite sure how to categorize that. So anyway,
that's a really good question.
Love any thoughts.
I think some of it is like what comes back to our brain as we're reading them and working through them. I know for me personally, anytime I get our documents, I start with the case summaries to get an overview. Like when I'm reading through things personally, I start with case summaries to kind of get an overview of where things are at. And then from there, we'll kind of cross-check with the agenda to see if there are contested cases that we're discussing or things like that that need to be there. I agree that the organization is a little challenging sometimes because when we get like an info dump, it's hard to make sense of it since we're not looking at it all the time. I'm open to organization suggestions, but that's the only small one I have.
We're
So
hopefully in the very near future going to be going to is it one box drive where you just drop everything into a system and you guys can go in there and look at everything. So I think that will help immensely. We're just in the process of getting it, and it's taken our IT, not person, but the whole group a long time to get it going. But I think that will help be able to manage what's in there.
This is Lynette, and historically I've asked for it a couple times, and I feel like it's kind of not happening again, where every open case be listed on the summary so that you can know if it's an administrative, if it's mostly been signed off and it's just waiting on a letter. I still want to know that. If it's, being presented as a new case, I want to know that. I want every case listed on that summary so that we can have something to cross-reference and know if we got all the documentation and have some things that we're remembering about each case, instead of getting like 4 of them on the summaries and then 6 more sets of records and not knowing where everything is landing. And then getting the regulatory report and seeing that there's, all these cases that are considered open, probably because they're still on someone's desk for that letter of intent. But I would really personally like to see everything on that case summary that is if it's in the report as being an open case, I would love to see it on the case summaries list so that we can follow what's still open.
I agree with that. And I think one thing to make it easier perhaps is that, they don't need to be highly detailed summaries for every case. It can be as simple as, waiting XYZ, like waiting signature, or waiting final order, or waiting board decision or board direction. Like it can be very, very general, I think, and brief, but I do agree that having kind of a master list that we can use to work off of will keep it a lot easier for us to keep it organized on what we're expected to look at and through what lens as well. Yeah.
I think that would help me too. Just thanks for that suggestion. The last question just related to this is the like I didn't can you remind me what would have been the contested cases we were discussing today of all these cases? Like,
I don't, that's the thing we could say in public session.
oh, okay,
And there's Heather.
that's fine. Okay.
Thanks, Meredith. You covered it.
Yeah. Can I
How
give
can
a
I learn what
general,
those are?
not
in the future?
specific? It would
It's
be the
basically a
things
case
where
and
we have to
process.
make a decision on.
Yeah,
As
so like if a
like,
letter of intent had been issued in that packet and there potentially was a response to that, that would be something we would talk about.
That would be the one. Okay. Okay.
Good questions.
Michelle, this is Heather. You can always contact Sammy or Trampus and ask those questions too, just to give you a frame of reference before you get to the meeting.
Okay, so that would be Tampus or Sam.
Oh,
'Cause
yeah,
I
we're
replied
going
to
Sammy.
the email, but I didn't get a response. But that would be Tammy or Sam. Okay,
Yep.
thank you.
those are great questions. Any other questions or board business or anything anyone needs to discuss?
Okay.
All right.
I know it looks like I fell
Okay.
asleep on the screen. It froze, but I'm here.
All right. So if that is it, then the Board of Direct Entry Midwifery meeting is adjourned at 11:29 a.m.
Thank you, everybody.
Bye.
Thank you.